The Geneva University Hospitals, HUG, one of the first hospital groups of Switzerland, operate abroad in over 30 countries. A number of collaborators from different medical departments are involved in sustainable development projects, essentially in Eastern Europe, Asia, and in Africa.
The Geneva University Hospitals are involved in humanitarian and international cooperation activities for several years now. The priorities and the objectives are really the transfer of expertise, training, research, and capacity building.
Many activities are underway, and a training program associated with the transfer of expertise and the training of trainers is one of the top priorities. According to an agreement signed in 1980 between the Universities of Geneva and Yaoundé, the medical schools of the two institutions undertook to establish an exchange program in training Cameroonian and Swiss medical students in Cameroon and Cameroonian doctors in Geneva. The cooperation involved biomedical and clinical sciences and community health. Lecturers from Geneva regularly teach both theoretical courses and practicals in Cameroon in pathology, physiology, infectious disease and community health.
Ça fait 10 ans que je suis rentré au Cameroun. J'ai essayé avec les collègues de créer un service de neurologie à l'hôpital central de Yaoundé. Et au bout de ces années, nous nous sommes dit qu'il y a des problèmes de drépanocytose qui est important au Cameroun, mais nous n'avons pas l'expertise au Cameroun ni l'organisation pour les prévenir. Donc je suis venu avec la collaboration avec mon ami et collègue Dr Steissel pour préparer ces projets de prévention des accidents vasculaires cérébraux chez les enfants drépanocytaires au Cameroun. Donc je suis venu me perfectionner à la technique des Dopplers transcrâniens dans ces laboratoires. À ma connaissance, je ne connais pas encore en Afrique de centre qui fait du Doppler transcrânien en Afrique subsaharienne. Donc il me semble que le Cameroun sera le premier pays à avoir ce laboratoire qui peut détecter les enfants drépanocytaires à risque pour faire les AVC. Donc je pense que le Cameroun va probablement devenir un centre dans la sous-région pour faire cette expertise.
Dr. Jean-Sylvain Lacroix has known the situation in Eritrea for more than 20 years. In Geneva or in Asmara, the Eritrean capital, the doctor and his team work hard on a daily basis for the public health of this somewhat fragile region.
The story starts 20 years ago, in February '85. That was during the Liberation War. And the Eritrean people were looking for an ENT specialist because they didn't have any ENT surgeon since 1941 when the Italian left the country. And I arrived after a long story of a difficult travel. Then I arrived with about 400 kilograms of equipment to set up the first surgical room for ENT disease.
I have worked in ENT since 1985 when Dr. Lacroix came to train us to the field. Then after all these years, I didn't have any paper which says I am a specialist. So I had to go to Geneva to get that paper and to see other sophisticated procedures and to learn from Geneva ENT specialists, and they did a lot for me. They have trained me a lot. It was very intensive. It was 1 year, but I gained a lot of knowledge.
Because the Geneva University hospitals have known how to receive and exchange, and because the in-depth work done locally is today bearing fruit, the public health situation in Eritrea is, in view of its history, constantly progressing.
If the support we are getting is to make good Eritrean doctors, then that means even if the association is stopped, and it will stop eventually, you have left a good Eritrean medical crew who can do what the Geneva doctors are doing. So for support to be meaningful and to be sustainable, it has to be able to build the people in the country's capacity So when you have as good doctors as Geneva Eritreans here, then you have transferred the know-how and the knowledge and the skill. But if you have doctors coming from Geneva, work and go, it's not sustainable because they can't come forever. So it becomes more disappointing once they stop. But if you develop the indigenous human resources, then that's lasting. They will teach the others, they will teach the others. That means you have built a national capacity.
Mais je pense qu'on a un devoir et un avantage à former les gens sur place, avec leurs capacités sur place, leurs moyens techniques, de matériel, et aussi pour que ce soit inséré dans leur culture et dans leur communauté, et qu'ensuite ils se sentent responsables du projet et qu'ils le fassent marcher, fructifier sur place.
Since 2000, the Geneva University Hospitals have been involved in coordinating the development of a network for e-health in Africa, first in Mali and now extending to 11 French-speaking African countries. The RAFT project is a network for distance education and telemedicine, coordinated by Professor Geispuler. This network aims at creating a South-South network of collaboration between the university hospitals, the regional hospitals and the rural health centres. The core activity of the RAFT is the webcasting of interactive courses. These sessions put the emphasis on knowledge sharing between care professionals, usually in the form of presentations and dialogues between experts in different countries. The technology used for the webcasting works with a slow internet connection. Other activities of the RAFT network include video conferences, teleconsultations based on the iPath system, collaborative knowledge bases development, support for medical laboratories quality control, and the evaluation of the use of telemedicine in rural areas via satellite connections in the context of multi-sectorial development. Finally, a strong emphasis is put on the development of capacities for the creation, maintenance and publication of quality medical didactic contents. Specific courses are organised for the national coordinators of the network to develop these competencies with the help of the Health on the Net Foundation.
Aujourd'hui, nous l'avons prouvé que ce n'est pas un gadget. Quel sera le besoin d'un médecin qui est dans un CESCOM, c'est-à-dire un centre de santé isolé en zone rurale? Lui, son problème, c'est de pouvoir traiter avec ses maigres moyens, avec l'absence d'équipement, les malades qui viennent le voir. Or, il peut faire ça comment? En ayant accès à ses collègues de par le monde qui ont de bonnes pratiques médicales, qui voudra bien partager, et lui aussi, il y en a de bonnes pratiques qu'il veut partager.
The humanitarian activities of the Geneva University Hospitals, HUG, are carried out most often in close partnership with private or public organizations. This is the case with the Heart for Everyone Foundation, Fondation Cœur pour tous, which brings together different European cardiovascular surgical teams. These teams operate in Eastern Europe, the Middle East, Latin America and Africa. Other examples of partnerships, the cooperation with Children Action in the context of a specific infant surgery project.
Demain, on a 2 ou 3 tables d'opération.
Les tâches sont les mêmes, mais ça dépend ça nécessite.
Au départ, c'est Children Action qui est venu me demander de participer à leur conseil de fondation, parce que, comme le nom l'indique, ils s'occupent essentiellement d'enfants et que je suis chirurgienne pédiatre. Le but était double, c'était des opérations de séquelles de brûlures et d'orthopédie. Or, j'ai une formation particulière pour le traitement des brûlés et je me sentais appelée à participer à ces actions chirurgicales.
Ça va très bien.
On peut même la mettre debout si vous voulez. Alors, je ne pense pas qu'on puisse avoir une action quelconque sans avoir des partenaires locaux. C'est-à-dire dans le pays où on va. C'est impossible. Et puis ça n'a pas de sens. Est-ce qu'elle a des questions?
Có câu hỏi là hỏi bà không?
Con rất biết ơn bác sĩ đã
Non, mais moi je demande si elle a des questions. Et puis les partenariats avec d'autres acteurs ici, en Occident, sont souvent nécessaires pour avoir suffisamment de personnes, pour avoir les capacités, les expertises, parfois pour des raisons de soutien financier, parce qu'on n'est pas assez fort pour tout financer nous-mêmes, donc on cherche des partenariats pour monter des projets à plusieurs, pour pouvoir apporter une expertise et une action sur place.
The partnership with institutional bodies and the NGO Project Hope, currently Foundation Partnerships in Health in Bosnia-Herzegovina, enabled over 700 local doctors and nurses to be trained in family medicine. The training is now administered by Bosnian doctors.
Là-bas, c'était un programme pour former des gens, pour leur donner des connaissances supplémentaires en visant le premier niveau de santé, donc la médecine de famille, et dédié aux médecins et aux infirmières ensemble en équipe. Puis après 3 ans, en fait, on a vu que les gens avaient des connaissances vraiment supérieures, mais qu'ils ne pouvaient pas mettre en pratique leurs nouvelles acquisitions. Donc la coopération suisse est venue avec un projet supplémentaire, avec l'idée de travailler, de développer le concept, comment faire en sorte que les gens mettent en pratique leurs connaissances et mettent des nouveaux services à l'exposition des patients.
We could completely rely on the experience, on the trainers, on the managers that have been made available, and this was crucial for us. Actually, it was the foundation of the success of this project. Furthermore, I think looking back on that one, it is not self-explanatory. I think the conditions in Switzerland compared to here are quite different. But the university hospital and the personnel that has been sent for this training program very quickly, very well integrated in the local system. They understood the difference between the two and adapted the methodology to it. Furthermore, what has been quite important for us, they were not just sitting on their know-how. They immediately started actually to train local people who gradually took over. And interestingly, that these local staff, not because the quality is better, but they were easier for them to communicate with the different doctors to train, have achieved even better result than the trainers from Switzerland.
Most of our projects are run in partnership with other organizations, and because usually these organizations are already on site, they run several projects, and they need the expertise from the hospital or the university. You have to develop a very strong partnership with the local institutions, because by definition we're not there forever. We can't be there every day. So, and on top of that, I think you gain much more. I mean, it's a good way to develop sustainability and through capacity building.
Research, the other important element of the HUG's activities abroad, is also the subject of precious collaboration. Several research programs are underway in Lithuania, Morocco and Nepal. Dr. Francois Chapuis is working with the Institute of Dahran in Nepal on Kala Azar, a condition transmitted by sandfly bites. This work has enabled the development of an efficient diagnostic tool.
We have been able to work together to identify the problems, and also we have tried to make some attempt to solve these problems. For example, for Kala Azar, we had the problems of diagnosis, which is difficult in the district hospitals, so we need to find some simple tests, and we have been able to validate simpler tests like the RK39 and the DAT, which is now, I'm happy to say, has been incorporated in the government policy as a diagnostic tool.
Now we have opened since September 2005 a second chapter of research, which is prevention, trying to decrease the incidence of the disease in this area, and testing for this a tool that is long-lasting impregnated bed nets, the project being called CalaNet and being coordinated by the Institute of Tropical Medicine in Antwerp. And really, the aim is to get a tool that could be used to decrease the incidence of the disease here.
So the mud structure is the important where they breed. And most favorable breeding site is the rat hole, because inside the rat hole, the rat fecates. That fecal material is the food for the larval stage of the sandfly. So that is the best place for breeding and growing. So in these houses, in these types of houses, we have more sandflies.
अहिले त अब बिरामी उपचार भएर त फाइदै लागेको छ राम्रो बाँचे जे भए पनि पहिले त अब मर्ने कि बाँच्ने भइराखेको थियो
हैन त्यो मैले भनेको यो झुलले फाइदा लागेको छ
फाइदै लागेको छ नि अब के गर्नु त नलागेको त झन् टोक्छ घुस्ना मछरले
The HUG's action in the field also means participating with the Swiss Humanitarian Aid Unit in the context of an intervention in emergency situations.
Un événement vient de se passer. De manière spontanée, le service sismologique suisse informe le corps suisse d'aide humanitaire de l'intensité de ce tremblement de terre. Et une première cellule de crise est constituée à Berne pour analyser la situation. À partir du moment où la chaîne de sauvetage décide d'être engagée, toute une série d'alarmes se mettent en place. Nous avons 6 heures pour nous rendre à Zurich. Et en fait, à Zurich, on se rassemble, l'entièreté du groupe se rassemble pour ensuite monter dans l'avion et être amené sur l'aéroport le plus proche. À partir de là, toute l'organisation se met en place pour en fait organiser le transfert depuis l'aéroport jusqu'au lieu du sinistre. Tout cela se faisant toujours en collaboration avec les autorités locales. Nous essayons, on va dire, d'armer au mieux des pays à risque, par exemple. Un joli projet qui avait été développé est un projet en Turquie qui s'appelait le Neighborhood Program. Ce projet étant basé sur le fait de transmettre les connaissances en termes de médecine d'urgence dans des situations de catastrophes naturelles, plus spécifiquement les tremblements de terre, aux populations locales qui, elles, seraient les premières impliquées dans cas de catastrophe. Et c'est un programme que nous essayons de reconduire dans d'autres pays, comme par exemple l'Iran, qui suit la grande faille nord-anatolienne.
One of the objectives of the training programs established by the Geneva University Hospitals in Bosnia was for the doctors and nurses to take on the teaching and adapt it to their needs and become trainers themselves. Each theory course is followed by practical sessions in the field. This adaptation phase is crucial, as this is when the work tools are developed that can then be adopted by the local personnel.
L'action en Bosnie, c'est surtout dans le domaine des soins de base, donc la médecine de famille. Et là, au début, il fallait les experts de Genève pour, je dirais, donner une connaissance plus large que la connaissance locale, qui était très bonne d'ailleurs. C'était d'amener des idées, d'amener des initiatives, des possibilités d'initiatives de ce qui se faisait en Europe et en Suisse. Alors au début, c'est vrai qu'on était plus impliqué en première ligne, et à l'heure actuelle, enfin, plus le projet se développe, plus l'ensemble des activités sont reprises par des experts locaux bosniaques qui sont excellents.
In the field of transfer of commonly known skills, it's worth mentioning training and the setting up of an intensive care centre in Ulaanbaatar, Mongolia, as well as the emergency radiology programme in Romania. The Geneva University Hospitals are also involved in a long-term mental health project in Rwanda. Immediately after the 1994 war, a team from the HUG left on a mission to assess the situation. Its first action was to create a psychosocial centre right in the middle of a ravaged country.
Toute la population a été affectée. En 3 mois, il y a eu entre 800 et 1 million de morts. Tout le monde, de loin ou de près, a été confronté à des atrocités. Et là, je parle surtout de rescapés, en commençant par les enfants à l'époque, les adolescents et les adultes qui ont pu survivre.
Today, after more than 10 years, the cooperation continues. Dr. Kanyan Denkwe is training in Geneva to be a psychiatrist on a course which is being conducted by teams from the HUG.
Dans le domaine de la santé mentale et de la psychiatrie, il faut surtout faire de la formation. En fait, toute la capacité des gens à donner des soins psychiatriques repose sur des compétences, sur un engagement. On soigne d'abord à travers la relation, on soigne d'abord à travers une certaine écoute, une certaine empathie pour l'autre, et naturellement avec aussi d'autres moyens tels que des médicaments où il faut un minimum d'infrastructures. Mais ce qui est important dans ce domaine-là, c'est surtout d'avoir des gens qui sont bien formés, des gens qui sont à l'écoute.
L'aspect le plus important que j'ai trouvé à Genève, et particulièrement dans le département de psychiatrie, c'est que la formation, à la différence de beaucoup de pays, que ce soit en Europe ou ailleurs, la formation est située à 2 niveaux. On est formé non seulement comme psychiatre, mais aussi comme psychothérapeute.
Notre spécificité, c'est ne pas arriver avec un certain nombre de recettes, c'est ne pas arriver avec des idées préconçues, mais c'est d'être à l'écoute, c'est leur demander finalement qu'est-ce que vous voulez dans la prochaine formation, de quoi avez-vous besoin, et ensuite de mettre tout en œuvre pour répondre vraiment à ce besoin.
The humanitarian and international cooperation activities of the Geneva University Hospitals have also had a powerful impact on the improvement of the collaborators involved in these activities. They all discover another reality, learn to work with limited means, question standard practices, gain new skills without mentioning the personal, human and institutional enrichment, most particularly in the context of local partnerships.
In a very productive collaboration with local institutions, international projects, I think your own institution needs to be also interested into that. Not only generous, but also have a direct positive benefit to that. And I think the benefit is at different level. At the professional level, there is no doubt that even if you practice cardiology or tropical medicine here, or travel medicine, or nephrology, or internal medicine, this is never going to be the same if you practice it in Mongolia, or Rwanda, or Vietnam. So you gain an awful lot when you travel. At the same time, I think it's extremely positive on the human level. In order to do so, you need to have a general spirit, I would say, in an institution like ours, which needs to be open to the world. And I think it's a must you need today. You can't be isolated, even in Geneva. So to me, and I think to most of the doctors here and nurses in this hospital, it's a fantastic opportunity and of great benefit professionally as well as on the human side for all of us.
Exchanges in the context of humanitarian projects only make sense in the medium and long term. In the area of health, as in other areas, the perspective of sustainable development is one of the priorities of all the parties concerned.
The basis is really to aim at long-term development, capacity building, and strong partnerships in between local institutions and the hospital. And you need to build this feeling of mutual confidence and to develop a kind of win-win situation where both partners are interested and have to gain into the adventure.